Hi, I'm Genevieve Ortega from the Philippines. I had my fellowship training in reproductive medicine at the Philippine General Hospital. I plan to pursue my career in IVF in the Philippines. We have 6 IVF centers in the Philippines. All are privately owned. 4 of them are concentrated in Metro Manila, the capital of the Philippines, and 2 others are spread across the provinces. We have about 137 fertility specialists in the Philippines, but only a few are practicing IVF. There are about 20 embryologists in the Philippines. We have 1 IVF center in the Philippines which offers observership for a month. So there we get to observe OPU, or ovum pickup, and embryo transfer. There's also a little exposure to the laboratory, but the in-depth training in IVF is not there. So most of our patients come in for investigation. Some of them opt out of treatment to try natural conception. Majority of our patients choose IUI even if their condition warrants IVF, for the mere fact that IVF in the Philippines is expensive, so only a few get access to IVF. We have 137 fertility specialists, but only a few practice IVF. We also have about 20 embryologists. So knowledge about male infertility is not too much, mainly because males do not subject themselves to investigation. It's a prevailing perception among the males that their female partners would have to undergo investigation and treatment first before they themselves subject to the investigation. I chose fertility as my area of expertise because reproductive medicine as a whole, I feel, is a very encompassing area of expertise, because with this field, we're able to understand women and their health concerns and issues all throughout their lives, from the moment of conception up until puberty, up until menopause. So it gives you a glimpse of the entire management for women. Specifically, one area that I'm interested in is in the area of ART, because I feel that being involved in the creation of life or hope for our infertile couples to become parents or biological parents, for me, is an achievement. It is my personal joy. It is my advocacy. Infertile women in the Philippines are not persecuted or stigmatized. However, there's a level of expectation for the woman to bear a child. Especially in our culture, we are a very family-oriented people. We like to have big families gather around for special occasions, so that there's a certain pressure or expectation for the woman to add children to the clan. I've learned so much in this training, from the theoretical aspects of IVF to the practical ones, like doing the ovum pickup, the embryo transfer, even the new skills I've learned here, learning to do the uterine cavity enhancement. I'm very grateful that the theories and basics of IVF have been inculcated in us. We also have real case scenarios to discuss. We get to do the ultrasound. We get to follow the patient throughout his or her course in the IVF process, from counseling and investigation in the clinics to formulating the plans prior to the IVF proper, to doing the ultrasound monitoring, to giving the medications, doing the OPU, doing the embryo transfer, seeing what happens in the laboratory, and even antenatal monitoring. So these things I feel we have been thoroughly exposed to, so that we can be confident to do them on our own once we go back to our home countries. I plan to bring my patients for IVF to one of the established IVF centers in the Philippines, just nearby my province. But God willing, we can have embryologists trained and an IVF building put up, established, so that we can start the IVF for the people in our province. I am immensely grateful to Merck Foundation for giving me the opportunity to learn IVF in depth. Now, I'd have more treatment options to offer to my patients, and not just IUI. I am grateful for this chance of extending my knowledge in IVF, for furthering my capacity to help our infertile couples now through IVF. I hope that I can bring to the Philippines what I've learned here in Indra and practice IVF the way they do it here, so that IVF can be made more accessible to a lot more Filipinos. I also want to thank our mentors here in Indra for their superb and generous sharing of knowledge and skills about IVF. Thank you for the very good, structured, and comprehensive training that you've created for us. Thank you for the adequate exposure we had here in Indra, both in the clinical and laboratory side. I think that my exposure here in Indra made me realize that there's actually hope for our infertile couples, that through the many cases that we've seen here in Indra, I came to realize that we can bring them hope, that women can actually be made to conceive. We just have to devise the ways. Thank you for showing that to us. I think it has been a very fruitful and productive 3 months stay here in Indra. Thank you, and I cannot thank you enough. Bahut dhanyavad. Philippines.